Welcome to this episode of Health and Wellness series. Today, we'll talk about health during menopause. I'm Dr. Lara Bhatnagar, board certified OBGYN.
I'm Dr. Sangeeta Shrivastava, registered dietitian. Dr. Bhatnagar, please tell us some of the issues faced by women during menopause.
Like adolescence, menopause is a stage of life characterized by several hormonal changes. Average age for menopause is 50 to 52 years, and perimenopause is 47.5 years. The most frequent issues encountered during this time are bleeding irregularities and vasomotor changes. The menses start to become less frequent and the amount of flow starts to decrease. However, some women notice increased duration of flow due to unopposed estrogens resulting from lack of progesterone due to anovulatory cycles. Another thing is the metabolism slows down significantly. Decrease in estrogen correlates with decrease in bone mineral density as well as increase in heart disease due to the loss of protective effect of estrogen on the heart. Night sweats may disrupt sleep. There are vaginal and urinary tract changes as well that occur from falling estrogen levels. There are several different interventions that can help, including supportive measures as well as dietary and hormonal supplements. Dr. Shrivastava, can you please tell us the recommended dietary intake of calcium and vitamin D?
That's a great insight, Dr. Bhatnagar. Yes, calcium needs at this time is higher, about 1200 milligrams of calcium and 600 international unit of vitamin D is necessary at this time to support bone health. Some of the good food sources can be dairy products like milk, cheese, yogurt, and also fortified calcium foods like juices and cereals, and other than that, soybean and also white beans, dark green leafy vegetables. Good sources of vitamin D, obviously the sunlight, and other than sunlight, mushrooms, egg yolk, fortified cereals, and also fortified juices, and also fatty fish can be optimal vitamin D sources. Overall diet, which includes all five food groups like whole grains, dark colored fruits and vegetables, quality protein, low fat dairy, beans and legumes, nuts and seeds, can be beneficial to support overall metabolic health. And RDA and some food sources are listed here.
Thank you for that. While ACOG does not recommend dietary supplements, most women are interested in knowing if they can get some estrogenic effects from day to day foods. Can you shed some light on those sources?
That's a great question, Dr. Bhatnagar. Yes, phytoestrogens are naturally occurring compound and they act as a weak estrogen in the body and they can bind to estrogen receptors. Some of the prominent sources are flaxseed, soy products like tofu, tempeh, edamame, cruciferous vegetables like broccoli, Brussels sprouts, cauliflower, dry fruits, and also some berries, and white beans like chickpeas, some green teas, and some fruits like plums, apples, etc. Numerous evidences shows now that they helps with the menopausal symptoms and they also decrease the risk for chronic disease development.